afternoon. This afternoon we're here with Miss World Caribbean 2015, Miss World third runner-up 2015, Miss World Jamaica 2015, a past student of the Carteret College, and she's a former deputy head girl from that school, and most importantly, medical doctor and surgeon of the Mandeville Regional Hospital. We speak of none other than Dr. Sanneta Myrie. Hi, welcome.
Hi, thank you for having me.
Lovely to have you here. First question. You're here to spread the light on the hot topic coronavirus. So I'll ask you, what is the coronavirus?
Okay, so very important question. First and foremost, have an understanding of what it is and where it's coming from. So the novel coronavirus, it belongs to a large family of coronaviruses that result in illnesses ranging from the common cold to severe respiratory diseases such as SARS and MERS. And it's novel because it's a new strain that was recently found in Wuhan, China, that results in coronavirus disease being in 2019, it's therefore called COVID-19, coronavirus disease 2019. Okay. So it's the novel coronavirus, and it results in flu-like symptoms, such as your coughing, your fever, your shortness of breath, and difficulty breathing, similar to MERS, which is Middle East Respiratory Distress Syndrome, or SARS, which is Severe Acute Respiratory Syndrome. And so, yeah, it's a large family of viruses.
So how is this virus spread? How is it transmitted?
So three main ways. You can have close person-to-person contact. So if you come in contact with a person who is ill, and you can have more indirect contact. So for example, when respiratory droplets from a person who's infected, who is sneezing or coughing, goes into the air and you're within close range with that person, you can inhale those respiratory droplets. Or if they fall, for example, on surfaces and you touch the surface, and therefore after touching the surface without washing your hands, you can then touch your eyes, nose or mouth and therefore become infected. And that's what we call indirect infection. So it's not directly from the person, but from an infected surface or from the contaminated air after that person has coughed or sneezed.
Okay, so break down the symptoms for us. What are the symptoms?
So the symptoms all have to do with once the virus invades the body and the body starts to mount a response. So it starts to fight off this foreign invader. And so it results in a fever. There's mucus production, because the mucus production results in the virus being less able to stick to cells and surfaces, and so you have coughing of that sputum or sneezing of those droplets. And because the receptors of the virus are in the lungs, which is the lower respiratory tract, you have people developing severe respiratory illnesses such as pneumonia and possible respiratory failure and death. And so because it invades the lungs specifically, you have these severe respiratory complications, of which we're most concerned about.
Okay, so how deadly is it? How deadly is this virus?
So another important question, and it's important to know because a lot of people are panicking at this point in time. So 80% of people, and this is what the data shows, and these things are always changing because it depends on the population that we're talking about, but 80% of the normal, healthy, young adults will have very mild symptoms. And so that's of the population we're thinking, right? So 80% of people will have little or no symptoms and will be fine. You have maybe another 20% or so who will have symptoms, and of those you will have severe symptoms. And then you have what is documented, a death rate of 2 to 3%, depending on the country you're talking about. So who we know are at risk of severe illness or even death are the elderly, persons with underlying medical conditions such as asthma or diabetes or sickle cell. And why that is because you need a robust immune system to fight this illness. And so the elderly population, we know, if you're an older person, your immune system is weakened, just the mere fact that your cells are older. If you have an underlying medical condition, your body is also dealing with that, and so it's less likely to deal with a new foreign invader. And so those people are at risk for severe illnesses. And the older population varies from country to country. So for example, Italy has a very high death rate, more than the 2% that's normally seen, because they have a very old population. So it depends on where we're talking about, but the average death toll is seen, or death rate is seen to be 2%.
Okay, so this is what is causing all this fuss? What's the fuss all about? The death rate?
Right. So the fuss really is the population or a society's ability to deal with the health demands of its population. So if you think about all Jamaicans, or a large number of Jamaicans getting sick at once, and therefore it's coming into the hospital can only treat so many patients and no more. And if we have everybody getting sick all at once, the healthcare system is going to buckle. And so remember, outside of coronavirus, we have people requiring medical attention for other reasons, whether it be a car accident, whether it be that you had a stroke, whether it be that you had a fall, whether it be that you are having other flu-like symptoms, or your blood pressure is elevated, or you have a wound that needs tending to. If the healthcare system gets overwhelmed with coronavirus, it means, one, we won't be able to treat those patients properly, because you have the healthcare workers can be burnt out, the supplies can only stretch so far and no more. And it therefore means that we cannot meet the demands of other people who need other medical attention. And so we will find ourselves in a situation where hospitals are overrun with the demand. Patients are in corridors without getting access to beds. You know that scene in the movie where you have people crying out for help, and there's no doctors or nurses around because they're dealing with so many other people. People are on the floor crying out for help. People are long lines outside waiting for beds. We don't want that to happen, and that is a very real possibility. In China, we saw where they had the ability to build a hospital in 10 days. We can't do that, and so we need the population to understand, while yes, 80% of people will be fine, and yes, there's only 2% of people will die, we still need to be able to meet the demands of day-to-day healthcare. And let me tell you, being a member of the healthcare system, I don't speak for Manda Regional Hospital or the Ministry of Health or anybody else for that matter. I speak for myself and my day-to-day experiences. On a regular day, we have an issue sometimes to meet the demands of our population. And that is just because our population is growing, and you can find at any point in time that we have a bed space issue. And so we really need to bear that in mind, that we cannot afford the strain. We need everybody to adhere to the restrictions in terms of public gathering, hygienic means, to protect not just themselves, but everybody else around them. We're all in this together.
In saying all of that, how give us some steps on how we can prevent it from spreading?
Right. So it goes back to how we know the virus is spread. So it goes into the respiratory tract, and so if you come in contact with respiratory droplets, you can get infected. And how you get infected is if you come in close contact. And so it's advised that you stay at least 1 meter to 2 meters away from the next person, especially if that person is sick and actively coughing or sneezing. You can see them being ill. If you're ill, please wear a mask. Now, a lot of people need to understand that mask is not for the healthy, because you're not sneezing, you're not coughing, you're not introducing respiratory droplets into the air around you. Masks are for the sick, so that whenever they sneeze and cough, those droplets are contained. So if you're ill, wear a mask. If you're ill, try and stay home so that you are not at risk of infecting other people. Washing your hands is very important, because you can come in direct contact with droplets and not know it on surfaces. And so washing your hands as often as you can, especially before you eat, before you touch your face, before you come in contact with other people. Wash your hands, and it's recommended that you wash your hands for 20 seconds with soap and water. And there's a saying that goes around, it's the length of singing happy birthday twice to yourself. So you wash your hands for 20 seconds with soap and water. If soap and water is not available, then you can use hand sanitizers. So hand sanitizer is not a must. It's not that you have to use hand sanitizer. It's only if you don't have soap and water available, and most people have soap and water available.
Right.
And you just lather your hands properly, get in between your fingers, under the nail bed, around your hands, and you wash for 20 seconds, and you wash it off, and you dry, and you should be fine.
Right.
Avoiding large gatherings, limiting your company to at least 10 people, no more than 10, definitely not 20. And again, if you're ill, staying indoors.
Right. You mentioned the gloves and the mask.
Mm-hmm.
We see a lot of people
Right.
wearing the gloves and the mask.
Right.
Who should be wearing gloves and masks?
So, gloves. And this is a very good question, and like you say, it's a practice that you see everybody now wearing gloves, and people are scrambling to get all the gloves that they can. You don't need gloves. As long as you wash your hands, especially before touching your face and eating, you should be fine. If you touch a surface and you have on your gloves, for example, you touch a surface with your gloves, and then you take off those gloves, you can still put yourself at risk because you're still touching the outside of the glove. If you're touching multiple surfaces and still coming in contact with people with your gloves and not washing your hand, you can still put people at risk. So gloves do not prevent. It might keep you safe for a time, but if you're still not washing your hands, you're still at risk. The masks are most beneficial to those who are ill. You save a lot more lives and you protect a lot more people if a sick person wears mask. And this is important to know because masks are limited. And in other places in the world, they've ran in crisis with limited masks. And healthcare workers who need the mask can't get them. You have price gouging with masks. So you see the prices in masks going up as much as 10 times as much. So if you are ill, you need a mask. If you're caring for somebody who is ill, so for example, healthcare workers, or you are caring for your ill aunt or cousin or brother or sister, then you wear a mask. Healthy people should make the mask available to those who need it.
Right. So is there a cure for coronavirus?
So no, there's no cure. In some parts of the world and in certain treatment protocols, there are antivirals that can help to mitigate the symptoms and the effects of the virus, but there's no cure. And to date, there's also no vaccine. You have scientists around the world who are desperately trying to scramble for the vaccine, but still not there yet. So no, there's no cure. You just have to wait for the virus itself to ride itself out in your system, so to speak. So most people recover within 2 weeks if you have a mild case of it, and severe cases tend to take like as much as 6 to 8 weeks to really recover from the virus.
Can you say how long it will take us to get back to normal?
Wow, that's a very hard question to answer in that it means you'd have to predict how long this particular viral strain will be circulating, because flus come in seasons, and the usual flu season is winter to fall, or in other words, like December to February, and sometimes it can extend as far as May. And during flu season, you have multiple strains of flu strains traveling together. And so some people now will have flu-like symptoms and have the flu, but not necessarily have coronavirus. And we see where people are getting tested and their tests are coming back negative, even though they do have the flu. It means that they have another strain of the flu. Because remember, it's a very large family of viruses. And so we don't know how long this particular strain will be with us. We don't know how many people will be affected, because it depends on so many different variables. Our response to it as people, it depends on the climate, it depends on basically how well it is that we're able to negotiate with it in terms of our quarantine protocols. So there are a lot of things.
So our current behavior is the new normal?
Well, for now, for the foreseeable future, and that is just to ride it out. And again, to prevent such a large spike of people getting infected all at once. China is getting to a place now where they're seeing less and less cases being reported every day. And this thing started for them in December, and now we're in March. This thing started for us last week. And so maybe we have about 3 months before we really get on top of it, similar to China, or maybe we'll get lucky and we get control of it sooner. Or maybe things will be in terms of how our population adheres to these protocols. If Jamaicans are stubborn, we might be in it for a long haul. So it really depends on us. Really and truly, it's all about how we approach this together as a society, as Jamaicans, how well we pay attention to the advisories of the Ministry of Health and Wellness, how well we cooperate and work together with our neighbors, and just informing ourselves and getting educated on what's happening in order to give us the best chance as a society to bounce back from this crisis.
Right, so you have a lot of people staying home, but you also have a lot of people having to go out. What advice do you have for those who have to go out in purchasing food and in, working out? What advice do you have for those people?
So I think the instructions are pretty simple and pretty clear. It's all about self-restraint and understanding the importance of getting this thing under control, right? So if you're ill, stay home. If you have to go out, and that is if, for example, it's unavoidable circumstances, you need urgent medical care or you need something urgently and you have symptoms, wear a mask. We all want to be as prepared as possible, and so some people are stocking up, which yes, can be a good thing, but you have to find that balance between hoarding items. For example, you have cases in other countries where people are fighting over toilet paper. So hoarding things and putting other people at risk for having a shortage or a scarcity of basic supplies, and preparing yourself adequately. So yes, you want to be prepared for yourself and your loved ones, but you have to purchase with a conscience to understand that in order for all of us to recover, everybody needs to have what they need. So everybody needs to be prepared equally. So don't go to the supermarket and buy 6, 7, 8 cases of toilet paper and clear off the shelves. Leave something for the next person. Don't buy all of the hand sanitizers and hoard them. You have people having 17 cases of hand sanitizer while others have nothing, or hand soaps. So buy with a conscience. Remember, once there's a shortage, you can have price gouging where people raise the price of things to, for example, you now have Lysol being sold for twice, 3 times as much as the norm, which the average person won't be able to afford. Condensed milk can go up. Basic things that we take for granted or that we need every day to feed our families can go up. And so yes, purchase and stock up, but be mindful of the next person. And just practice basic hygiene. So if you purchase something from the store, when you go home, you wash your hands. You can wash the item with the usual disinfectant that you have available, leave it to dry, and then you can proceed to using that item. What's important to know on absorbent surfaces, so porous surfaces like cardboards or papers that surfaces with like paper or that's soft, the virus can survive 8 to 10 hours. Harder surfaces like glass or countertops, it can survive for days, like 3 to 5 days. The virus can survive in the air once a person has coughed or sneezed for hours. So even if you should cough, if you're infected and you should cough, and you leave this room can still, the next person to come in within 3 hours can still be infected. So it's very important to know those things, to take the necessary precautions. And hygiene is the most important thing, which people should be practicing at baseline anyways. So just always be mindful. If you go outside or you're up and about, when you come home, take off the clothes that you were wearing before, leave that aside, take a shower, wash your hands, get into clothes that you have in the home, and leave what you were wearing outside to wash separately from your indoor clothing. And other basic hygienic practices that we should be taking.
What is the Mandeville Regional Hospital? What are the steps the hospital is taking?
So at this point, we are in emergency service mode. So we've scaled back in order to protect the patients that we currently have, as well as to protect the patients that will be coming in. we are taking steps to basically reduce the non-essential services of the hospital. So we've scaled back our outpatient departments, those are patients who be coming into the outpatient clinics for services, for your routine checkups. So every 3 months, you'll have patients coming to clinics for checks. Those patients will be rescheduled based on the merit of or urgencies of their cases to limit how many people we have in the clinics at any given time. Because sometimes we have 100 people waiting in the clinic areas, which we can't have, because again, we're limiting public gatherings to 20 or so people. So we've scaled back our services. I work with the general surgery department, and usually we have elective cases. Those are scheduled surgeries for minor things, sometimes major operations like hernia repairs or mastectomies, things like that. We've rescheduled those patients. Some patients will be given appointments as far as 3 or 4 months. Other patients will be rescheduled based on their urgencies. And so that is just to limit the amount of people that we have exposed to patients with the coronavirus, which we do have at the Mandeville Regional Hospital. And Mandeville is the regional isolation center, meaning the southern region, which serves St. Elizabeth, Mandeville, and Clarendon, we serve as that isolation point. So any patient who is COVID positive will come to the Mandeville Regional Hospital from those regions. And so we have to be mindful of that.
Okay, and last question. Who do we listen to? We have so many news going around. Who do we listen to? Where do we go to get our information as it relates to this virus?
So it's very important to get certified, authentic information by medical professionals. The ministry is doing a very good job in keeping the population updated in terms of measures and steps to be taken. And they have hotlines with numbers available where you can call in if you have symptoms. So we're asking, if you think you're ill, do not leave your home. But if you need urgent medical attention, because like I stated before, some people will have severe illnesses and they will need to come into a facility for treatment, for additional treatment. And that is our elderly and those with underlying medical condition. You can stay at home and let the ministry call in one of those hotlines, and you can be further advised as to what steps to take. You also, if it's a case where you need to move, then if you're ill, you put your mask on, and your family members will put their mask on as well, and try to get to the nearest healthcare facility. But keep aware, be aware, be vigilant. See what the ministry is putting out, because like I said, they're doing a very good job in disseminating the information that is needed. The ministry has its website that you can go onto. You can log on there. And you can also follow, if the younger population, we're all millennials, we have our smartphones with all the apps and social media, and the ministry is making use of that. We see the Prime Minister tweeting, we see the Minister of Health tweeting, and therefore we're getting real-time information. And so we have to use social media has its drawbacks, but it also can do a lot of good. And you have to be aware and be conscious and share the information that needs to be shared. So don't share the memes. Well, you can share the memes because we need a laugh, right? Laughter is good. So you can share the memes, but also make it your point of duty to, in addition to sharing the memes, sharing the vital information that needs to get out there, which is the hand washing, the wearing of your mask. If you're ill, sneeze and cough into tissue or napkin and throw those away. Don't keep a rag, because once you're sneezing or coughing on a rag, you can therefore keep infecting yourself, and somebody else can take up the rag and get infected. So dispose of anything that you're coughing and sneezing into. If you are taking care of a loved one, ensure you take the necessary precautions and protect yourself, wear your mask. Stay home if you have mild symptoms but are symptomatic. Avoid public gathering, which we're calling social distancing, which is at least a meter away from the next person. So share those things. And also, let's not give in to the hysteria, because there is a lot of false and misinformation circulating, a lot of myths, and people are panicking, and the hysteria is going to do more harm than good. And if people do not have the adequate information and they're overreacting, they can put themselves in more danger. you'll find that some people are saying drink bleach, some people are saying if you mix a certain amount of compounds like vinegar and bleach or hand sanitizer and bleach, that's a good disinfectant. Combining certain chemicals are dangerous. And so use the regular disinfectant that you have to clean your surfaces. There's no magical cure, there's no magical pill, there's no magical formula. A lot of the basic things that you have in your home can be helpful. And so don't give in to the hysteria. Yes, be aware, be informed, but find a balance between calm and informed and completely hysterical.
Right.
But there are a lot of myths circulating around that we need to really, we really need to get people adequately educated and informed so that they can protect themselves.
Okay. All right. So there we have it from the Dr. Sanneta Myrie. Vital information. I hope we all take it and follow her advice, follow her facts. And that's it for this afternoon. Thank you for watching.
I do want to say though, we're all in this together. If things escalate, it's going to require isolation, but we have to isolate together. We have to understand that we are alone, but together. In terms of some people are afraid of being locked away. But when you lock yourself away, you're not only protecting yourself, but everyone else. And so we're really all in this together. We're isolated together. We're alone together, and we'll make it through together. Okay. So just stay aware, stay informed, guys, and we'll make it through this.
We will make it.
Yeah, we'll come out on the other end, and we'll get back to normal. Maybe not as soon as we hope, but we will get there. There's light at the end of the tunnel, for sure.
We will get there, yes. From Dr. Sanneta Myrie. Thank you for watching.